I'm Fiona McKevitt. I'm one of the neurologists. And I've been told to just crack on and talk over you. So that's what I'm doing, because I do as I'm told. So I've been asked to come and talk to you today about migraine, but specifically one of the new treatments that is now available. And I'm one of the neurologists at the Sheffield Teaching Hospitals, but I'm also involved with the Cases Neurology team. Migraine is a really, really common problem. So 10 million people in the UK are affected by migraine, and 1 in 3 women will experience a migraine any time in their life. So really common, and it's something that you're likely to see quite commonly in your practice. And because of that, we have done a document giving advice on migraine management. And this is an old document now. It's published. It's on Primary Care Sheffield website. And that was done in conjunction with GPs and secondary care neurologists. But we're updating it. And there's a few reasons why it's about to be updated. And imminently, we're going to be publishing the second version of it. Oh. So this is the document that we've already done. My advice was always to try and get it down onto 1 sheet. And as you can see, I failed quite spectacularly because I got it onto 6. But this is much, much shorter than the British Association for the Study of Headache Guidance, which runs to about 75 pages. And the main bits of the document talk about how you make the diagnosis of migraine. It talks about red flags for headache. That's what people tend to often be worried about. We're missing something more significant. And it talks about acute treatments and prevention treatments as well, and sort of talks you through what drugs to be thinking about and how to start them. What has changed? Well, one of the big things that's changed, and the reason why we decided to update the guidance in the first place, was the MHRA guidance on topiramate. It was previously said not to be used in pregnancy, but because of concerns of its use, there is quite strict guidance now for women who have childbearing age and are on topiramate, and this is for the indications of epilepsy and migraine. Patients need to sign an annual risk acknowledgement form. So there's a separate page where you just link through to that gives you all the advice on topiramate and the conditions for use. And we've also changed the name of the document, and we've included secondary care elements of migraine management as well. So previously this was migraine management in primary care. This is now a migraine management full stop, the whole pathway. And we've done a flowchart and had sections of primary care, what's available in primary care, and what treatments are available in secondary care. And this is the drug that I'm going to talk about today. So this is Rimegepant, and this is one of the new drugs that's available now for migraine treatment. In the document, it talks about being used in acute treatment, and this would be third-line treatment. So initial treatment, often with simple analgesia or sumatriptan. Second-line treatment is with an alternate triptan, and this would be third-line treatment for patients with acute migraine. So this has NICE approval, and it's one of the CGRP inhibitors. There's 6 of them now available for usage in England. And Rimegepant is an oral version. 4 of them are subcutaneous injections, but Rimegepant is a wafer that's put under the tongue. And it can be used, and this is how it is unique, it can be used for both acute and preventive treatment. There are no contraindications to Rimegepant except if you've had it before and you've had a hypersensitivity reaction. And this really differs to triptans. So triptans can't be used in patients who have ischemic heart disease, peripheral vascular disease, who've had a stroke, for example. But Rimegepant doesn't have those contraindications. It's an incredibly well-tolerated medication. The only real listed side effect is nausea, but it can cause hypersensitivity reaction, but that's very uncommon. In South Yorkshire, the traffic light status is being changed to reflect the NICE guidance on Rimegepant and the fact that there has been growing experience of using this now in secondary care. And so for acute treatment, so that's for the actual migraine itself, this has a green traffic light status. And this can be used in the following scenarios. You've had tried triptans, which have been ineffective, or triptans are contraindicated and simple analgesia such as ibuprofen is ineffective. So they would be the licensed agreement where you can consider using Rimegepant, and that's green traffic light status. For prevention, so it's one of the possible treatments for people who have more than 4 migraine headaches a month. It's currently red traffic light status, which means it can only be prescribed in secondary care. In the coming weeks to months, potentially this is going to change, and this may change to Amber G, which means it's initiated in secondary care, it's evaluated in secondary care, but once the patient is stable and it's felt to be effective, then prescribing can be moved into the community. So currently red, but possibly going to change to Amber G. If you want more information regarding migraine or the newer treatments, we are updating this migraine management document, and it's going to be available on Primary Care Sheffield's website, but also on IMOC's website. And then there's also going to be a supporting information leaflet both for clinicians and for patients on Rimegepant, and that's going to be available on the IMOC website. If you did want more specific learning, I've only given 10 minutes, so if you did want more detailed learning event with regards to migraine, I'm speaking next week at an NMP event. That's going to be on Teams, and I think it is being recorded, and that's for, I think it's Sheffield, or it may even be the whole of South Yorkshire. But if you wanted more details and wanted me to pass the link on, please just email me and I'll send that on. And then if you feel that you want additional information, particularly about the newer drugs, or you would be keen to have a learning event, there's an email there. Charlotte McMurray, who's a pharmacist at the ICB, has offered to take any requests for learning events. And I think that's my 10 minutes, Emma. Cool. Thanks very much for your time.